Okay, we're speaking now at the Crisis Recovery Center in DuPage County with DuPage County Chair Deb Conroy and County Board Member Sam Tornatore. To both of you, congratulations on your opening here. Chair Conroy, this is obviously fulfilling a big need in DuPage County. We've talked about this previously. What are your thoughts on the opening of your new facility today?
Well, as I just said to Sam, who is also the chair of the Health Department Board, it feels like Christmas morning. You know, this has been something that so many people have worked so hard on for so long. It's been about 6 years in the making, and I think it's a testament to if you dream big and you work hard and you put the right people at the table, you can really get it done. Very good.
Mr. Tornatore, on the Health Department Board now, was this one of your long-term goals, is to continue to address the need for behavioral health services in DuPage County? And how does the Health Department fit into something like that?
The Health Department has been dealing with behavioral health issues, of course, but this is the culmination of a dream for many, many people, and the ability to now have a place to go, which is what exactly the Crisis Recovery Center is, for people in crisis to avoid going to emergency rooms or police departments or fire stations, but to come somewhere to meet someone, greet someone, be greeted by people who know about behavioral health to ultimately determine what's the best next step. So it's a wonderful opportunity. It's a dream come true for so many people at the Health Department and the county who have been working for it many, many years.
Chair Conroy, I know you mentioned when you were in the state legislature, you wanted to work in this area about mental health issues and service to delivery in people in Illinois. So here you are now, several years later, of course, but you've actually managed to get this done locally, and I'm sure your colleagues from the legislature want to know how you did it, right?
Well, my colleagues from the legislature, particularly the DuPage, Tara Costa Howard and Stava Murray, so many others, were very helpful in getting the money to originally start working on this program. Many of them will be here today to share in this amazing day that we're all going to celebrate. But yes, I had the privilege of chairing the Mental Health and Addiction Committee in my time in the General Assembly, which was a time that I learned more about people that were suffering on both the mental health and the substance use side, and seeing how those are really co-diagnoses now. And children in particular, families not knowing what to do when they're not sure if their kids are okay. So this facility will be the first that will actually have a children's hub, which is very close to my heart, having raised 4 amazing sons. But I think the message here is that in DuPage County, it's okay to not be okay. It's not okay to have nowhere to go, and now we have somewhere to go, and the journey to wellness starts here.
Cool. Yeah, so right now you're in the triage area where when families first come in the door, or in our secure entrance here, if they're dropped off by first responders, they're going to get that initial assessment, do kind of that intake process, and see what they might need after that. So this will be kind of stabilization and triage here. So this is one of the things that also makes this very unique, what we're doing. A place for youth, especially, is something that doesn't really exist. Right. And so we're ready to kind of see youth anywhere from ages 5 through 17 to kind of wrap around with the level of care that they need most in their kind of moment of crisis. So you can see one of the biggest themes of the whole facility is consistent here is this like very warm, open space, inviting. We work with our partners at Wheaton Company, the architectural and design firm that has really understood our mission and also helped us to embrace biophilic design, which is sort of this love of nature.
Yes.
And so as much as you can bring in natural light, but
right.
more than that, when you can create more of a nature feel, even inside, in the interior, it all promotes health and well-being.
Yes.
So you see the colors, the lighting, the wood paneling, all of that is something that was very intentional in this design.
Yeah.
And then clinically, we will be staffed with everything from peer specialists to crisis counselors, therapists, psychiatric nurses, prescribers. So again, once we triage and whatever that level of need is, we're ready to flex into that space and take care of them and wrap that care around.
Yes, okay, so whatever the situation calls for. And I did notice the colors are very calming. And the preserved moss up front is all very calming nature. Yes,
that's one of our favorite features as well.
Yeah.
And so you can see the concept is also that it's semi-private spaces with, we have a family room back there that does have a closed door. There's some other family rooms in some of the passageways that you'll see, that if there is something more intensive or something going on where we need that whole family approach, we can go to those spaces. But for the most part, the design is that, when people are in a moment of crisis, they just need a safe place to be. They need time and space. They need to be with the people that understand and can provide the right care. And typically that resolves, certainly in less than 24 hours. We understand in the research is about 9 hours, and then we'll get you onto that care plan. So here is where adults experiencing some mental health crisis can come and have a similar care plan developed. Stabilize, meet with peer specialists, people with lived experience, meet with a crisis counselor, a therapist, or if there's medications that are involved, we'll have psychiatrists available to prescribe medications, and just, again, be here in the time and space they need to kind of calm, recover, and come up with a care plan that will follow them out back into the community.
Nice.
So
I love the balcony.
Very similar things. Yeah, and that always reminds me, that's an important feature, is that this is completely voluntary experience as well, right? So people have to want to come here.
Right.
And so it's not like locked down unit or anything like that. It's a voluntary, I need some help, this is a place to be to kind of figure it all out. So yeah, they also have direct access to outdoor and a little bit of nature there. And we're going to be growing more of the landscaping as well, so it'll look really nice. These are those family rooms I mentioned.
Yeah,
So again,
nice.
if we have more family that need to be on the unit, if there's something maybe more intensive, we need to take it out of the unit, there are private spaces that are available to be used for that. And everything that's off unit is badged staff area, so it's very secure. Staff will shepherd people between the units.
Okay.
Now this space is the substance use pod or wing. And so what's unique here is it allows both a space for sobering, which we can talk a little bit about that, but also withdrawal management. So somebody who is experiencing a substance use crisis can come here, we'll assess their level of need, and if they
Right.
just need a safe place to be while they sober up, this is a great option for them to just rest and just be there safe. You'll notice they are low to the ground. When we studied other centers, if you put like a higher up bed, there's the risk of falling out of the bed.
Oh, gotcha.
So safety was in mind everywhere.
Yeah.
And so that's kind of how that works. But if that's your need, there's I think 5 spaces for that 5 individuals at any one time can be there to sober up
Okay.
and have supportive presence again, peers, therapists, counselors, etc. The rest of the rooms, there's 6 spaces that are actually private rooms. So if you are going through a substance use withdrawal, you're going to need a space to be private and rest and recuperate and manage that withdrawal. This is the only area where we think people might be here for more than 24 hours. So generally we're saying this is a 2359 facility, meaning anybody in a mental health crisis, youth or adult, our goal is to stabilize, get that care plan, get them back home with family, back into the community, right? But here we recognize this process may take a little bit longer. And so if somebody needs to stay 3 days or 5 days or whatever it may be, that is going to be how these rooms are managed.
Would a private clinician, a physician, for example, be able to, like if they had someone as a patient, would they come here, or is it your team that handles their detox and then getting them ready for the next step?
It's our team that handles it. One thing I will say is we are partnering with Superior Ambulance, where they're going to provide EMTs to be on the unit. So we have a partnership for the EMTs to be present. But otherwise, if somebody's here and they're under the care of another doctor, primary care, we're just going to work with that entity. We'll communicate however we need to coordinate their care upon leaving our facility.
Mm-hmm. What are the costs to someone during the time that they are using your services here? How is that determined?
Yeah, so we're going to provide care to anyone who needs it, regardless of their ability to pay. We are going to operate in some ways like regular healthcare, where if you have insurance and we can bill insurance, we will, but we won't leave anybody with a bill that's beyond sort of their standard out-of-pocket considerations, right? And so we will have programs in place that make sure nobody's turned away for ability to pay, and they receive the care regardless of whether they're insured, uninsured, doesn't matter. Yeah, so these are the 5 sort of sobering spaces. Again, what we found in a lot of the research, our team traveled kind of around the country. They went to California, Virginia, Texas. They looked, I think, Florida. They looked at all these different centers and brought all of the best elements from each here. And one of the features they found was that a lot of times people just need a space to be. Yeah. They otherwise end up waiting while intoxicated in an emergency room hallway bed, or sometimes interacting with law enforcement and end up in a jail cell, right? And neither of those are great places to be when you're intoxicated. You're not going to get connected to the right care. And those aren't great uses of those community resources either. So this is really, something that we're excited about offering to the community and people in need. Be here, be safe. We'll have people with lived experience or other clinicians available to talk about whatever your plan needs to be.
Did you have to discuss with your team whether or not these are going to be closed off? Because they obviously are not. They're open, so is that so your staff can monitor them?
Yeah, a lot of the openness that you see throughout the building is about lines of sight for safety. So we do know that safety is paramount to everything we're doing, of course, and so it's a lot of making sure that the staff can have eyes on as many people as possible at any given time. Okay, yeah, and one other cool feature I'll just mention is you'll notice that we built this in connection with our existing building, the Linda Kurzweil Community Center, where there's also actually, and has been for a little more than a decade now, a 12-bed adult psychiatric what we call crisis respite space. And so that's where adults that are having psychiatric symptoms that aren't quite the level of an inpatient hospitalization, they can be there for another 4 or 5 days as well. So sometimes we may be saying, we've assessed your need and actually we're going to have you come over to our existing space and care for you there for a while.
Yeah, that makes sense.
So we're really expanding on a lot of the services that we already deliver.
Right, that's awesome.
Welcome to the DuPage County Crisis Recovery Center ribbon cutting ceremony. Please turn your attention to the screens for a brief video. Thank you.
Real help starts with the DuPage County Crisis Recovery Center, where support is available 24/7. When you or someone you care about is going through a mental health or substance use crisis, it's easy to feel overwhelmed and unsure of what to do next. Whether you're facing an urgent need or just need someone to talk to, the DuPage County Health Department team is here for you. Call us or walk in. No appointment is needed, and we're ready to help when you need us. The Crisis Recovery Center serves youth ages 5 through 17 experiencing a mental health crisis, as well as adults 18 and older facing a mental health or substance use crisis. Children under the age of 5 can receive an immediate assessment and may be connected to community providers for ongoing support. When you arrive at the Crisis Recovery Center, you'll be welcomed into a safe, supportive space by a compassionate team trained to handle mental health and substance use crisis. A calming place where you're respected and secure. We can create a personalized plan that meets your needs, whether you need short-term support, someone to talk to, or long-term resources. We provide crisis counseling, peer support, medication management, and withdrawal management services if needed, as well as linkage to ongoing community services. Seeking help takes courage, and it's a sign of strength. Whether it's the middle of the day or the middle of the night, we're here to listen, to support, to help you move forward. Real life brings challenges. Real help starts with the DuPage County Crisis Recovery Center. call 630-627-1700 or walk in 24/7 at 115 North County Farm Road in Wheaton, Illinois.
Good morning and welcome to DuPage County and the DuPage County Crisis Recovery Center. My name is Sam Tornatore and I'm the president of the board of the DuPage County Health Department. Thank you all for being here. On behalf of the DuPage County Board of Health, it's an honor to welcome you today as we celebrate a major milestone for public health in DuPage County. After many years of thorough planning, collaboration, and execution, we're introducing you to the DuPage County Crisis Recovery Center this morning. The opening of this facility is the final step in a decades-long journey to revolutionize behavioral health care in DuPage County. This morning, you will hear from just a few of the many people who have made this day possible. You'll learn about the new level of care, which we'll soon be able to provide, the team of behavioral health professionals who will provide it, and the people we will help in their greatest moment of need. And yes, the beautiful building behind me where it will all take place. But to take a step back, I believe that the new Crisis Recovery Center is a statement about who we are as a community. That when someone, anyone in crisis, they deserve immediate, compassionate care. And they shouldn't have to jump through hoops in order to get it. As many of you know, the need for accessible behavioral health care has never been more urgent. Families across DuPage County and across the country are increasingly struggling with mental health and substance use challenges. Too often, the systems meant to support them are confusing, delayed, or out of reach. We often talk about public health as being about prevention, access, and equity. This center embodies all three things. It will save lives, it will remove barriers, and it will demonstrate that in DuPage County, no one will face a behavioral health crisis alone. Again, thank you for being here this morning to witness this milestone. Thank you for all the roles that you've all played in making this happen, and thank you for continuing to stand with us as we move forward together. And now I'd like to welcome to the stage the person who in many ways figuratively and literally helped build the foundation for this Crisis Recovery Center when she was in the legislature, our County Board Chair, Deb Conroy.
Thank you, Sam. I'm so pleased that you and I are celebrating this moment together. Your dedication and support as Health Department President has been essential to this project. I'm grateful for your efforts and your friendship. Well, this is a great day in DuPage County. It's a great day for those of us who dreamed big and worked hard, all of you. We knew that we could create a gold standard for community mental health and substance use care right here in our own backyard. We dreamed of a place where there was no stigma, where everyone was welcome and where people in crisis could start their journey to healing, including and especially our children. But even I didn't dream that the resulting building could look this good. Thank you, Drayson Dwyer and White Construction Company, for exceeding our expectations. Back in 2019, as chair of the Illinois House Mental Health and Addiction Committee, I heard from families in need from all over the state. Families and individuals suffering from the impacts of mental illness and addiction that needed diagnoses and treatment that they can access and afford. Together, my colleagues in the legislature, please stand, so many of you who are here today. responded to that urgent need. They helped me secure $5 million to help fund construction of the state-of-the-art facility that we intended to be the model for our region, our state, and our nation. Now in DuPage County, those who seek help for mental health or addiction crises have someone to call, someone to respond, and most importantly, somewhere to go. A tremendous thank you to my colleagues on the DuPage County Board who heard and felt this need. You came together and unanimously allocated more than $15 million to build this center. Your support will change lives. Please stand. I want to welcome our mayors, township, and other local elected officials. I want to thank our emergency responders, police, and firefighters who knew long before anyone else that taking individuals to jail or even the emergency room wasn't the best course of action for our friends and neighbors in crisis. We thank you for your input and partnership as we work toward a better way to get people back on the path to health and stability. When you bring the right people to the table, amazing things can happen. I thank Dwight and Company. Jason Dwyer didn't just come to the table. He and health department staff jumped on a plane to see other centers around the nation. We learned what other centers were doing, and we learned what we could do better when this facility was built. And boy, did they deliver. Today, a new dream begins. Today, I ask you to join us in changing lives. Take a tour. Most importantly, tell your friends about our state-of-the-art recovery center. The more we talk about mental health and addiction, the more we break down stigma and make it easier for people to seek treatment. Let folks know that what they need is right here. Everyone is welcome. Youth and adults, insured or uninsured. Medicaid users, welcome. No judgment, no stigma, no noise, just healing. And it's right here in our own backyard. Now that is something to celebrate. When I say putting the right people at the table is the most important thing that we can do, and we've done that, I'm really happy today to have Lindsay LaPointe, who is the chair of the Mental Health and Addiction Committee. She took off where I left off, and she's taken it to the next level, and I'm incredibly proud she's here with us today.
Wow. DuPage County, Chair Conroy, the board, my colleagues from the Illinois General Assembly, this is such an exciting day. And I see tears in people's eyes, and they're tears of joy, but they're also tears because most of us have experienced some level of crisis, or a loved one or somebody we know or care about. We've needed this for so long, and so I feel that joy and I feel those tears of relief. I'm so happy to be here today with you in DuPage County as we unveil a vital, life-saving resource, the Crisis Recovery Center, that frankly we need in every corner of Illinois, and we're optimists, so we will get it in every corner of Illinois. We will get it. I'm here in part because I'm proud to carry Chair Conroy's torch as the chair of the Illinois House Mental Health and Addiction Committee. And I'm grateful that we have some DuPage County legislators on those committees. And they're not all here, but I still want to name them. We have Rep. Tara Costa Howard, who's on the House Mental Health and Addiction Committee. Rep. Michelle Mussman covers a little bit of DuPage County, and then we have Senator Karina Villa, a former school social worker who's on the Senate Behavioral Health Committee. And they are all here in spirit, and Tara, I see you, my seatmate. But I'm also here because affordable and accessible behavioral health care is a top priority for me. And we need that for everyone in all forms. And when I say behavioral health care, I mean mental health, I mean addiction, I mean recovery, I mean harm reduction, and I mean trauma support. And when I say all forms, I mean prevention, mental health screenings in public schools, peer support, talk therapy, crisis intervention, which is what we have here, and psychiatric treatment, and that's just to name a few. We have come such a long way from the days of stigma and isolation and psychiatric treatment being the main form of our response to people suffering from mental health crises. You have all come a long way in DuPage County from the days of 911 or jail or just a hospital being the only response. But I also know, you know, that we still have an incredibly long way to go until we have quality crisis response for anyone who needs it in every corner of Illinois, no matter the time of day. But here in DuPage, you're leading the way. You're lighting a path so the rest of the state can follow you. I want to take a moment to talk about just how life-saving public awareness can be when it comes to mental health and a crisis response. And that's one of the reasons why I'm so heartened that there are so many people here. Back in June, in the district I represent on the far northwest side of Chicago, I was at a local police district council meeting and I was giving a presentation on mental health and policing. And there were only about 25 people there, but as part of the presentation, I asked the group, how many of you have heard of 988? Raise your hand. And about a quarter of them did, which was okay, not great, but okay. And then when I asked how many people know who the mobile crisis responder is, or know what mobile crisis response is, period, or who the provider is in our area, nobody raised their hand. Absolutely nobody raised their hand. And so that reminds us all that crisis response cannot be just a phone line. I love it that more people know about 988, but that is just the beginning. It's a three-pronged approach. And we must stay laser focused on public awareness. So just like Chair Conroy said, talk about this. We can't assume that everyone in DuPage County knows about this. When we build out the entire system, it is going to be a three-pronged approach, and we are getting there. So number one, 988. We need a place to call, and we do have it, that everybody knows about. And not quite everybody knows about it yet. We need somebody to come, and that's the mobile crisis response. And everybody has to know about it. Not everybody knows about it yet. We need a place to go, which of course here in DuPage is now going to be the CRC. And it can't just be jail. It can't just be a hospital. That's not where people heal. And everybody has to know about it. None of it works if we don't do the public awareness and talk about it with our friends and family and everyone, everywhere, in every zip code in Illinois. And in some places like DuPage, you have it. And in other places like Southern Illinois, or even where I live in Chicago, we don't have a place to go that's not jail and the emergency room. Old habits are really hard to break. We all know that. We're all human. And for decades, we have all been calling 911 for mental health crises. For decades, first responders have been the main people responding to mental health and addiction crises. For decades, police and fire have been dropping people off at lockup or at ill-equipped ERs. And those habits are gonna die hard, even in places here where you have a beautiful new building. So keep up the PR, keep up the media coverage. That will save lives too. One final thing I want to touch on is the amazing frontline behavioral health workers that will continue to offer this life-saving support. None of this will happen without the frontline behavioral health support workers. And there's a truth about those folks, no matter where you are in Illinois, and that is we have tended to undervalue and underpay our frontline workers. These are folks with graduate degrees, like many of you have, like I have, with clinical licenses, like Lori Carnahan has. Many of us have student loans, And I do know that DuPage is leading the charge, and you've got those higher salaries, as they should be. But in many parts of Illinois, you can have a clinical degree, you can have a master's in social work, you have student loans, and you get a job, and you're earning just about $40,000 a year. So to those folks, those frontline workers, I want you to know you have allies in Springfield. The decisions that we make are directly tied to making sure that every county in Illinois can have a frontline workforce. It's tied to Medicaid reimbursement rates. It's tied to adequate health and human services budgets. So we're going to keep fighting that fight in Springfield for you. You're going to do the incredible life-saving work here, and we're all going to do it together until we have a place to call, somebody to respond, and a place to go in every single corner of Illinois. And two key people in that, before I turn it over to Lori Carnahan, and these folks are here today. We have Director David Albert from our Office of Behavioral Health and Recovery. And in Illinois, we have a Chief Behavioral Health Officer, and that's Chief Inger Burnett Ziegler. We are so proud to work with you. You are a part of this too, and so we're all going to make the change across the state together. Yes, we are. So now, it's my pleasure to introduce you to someone many of you know, Lori Carnahan, who's a huge leader in behavioral health in DuPage County. And Lori shows up in lots of spaces. This is not my first time meeting her because she does work that affects the entire state of Illinois. DuPage County is so lucky to have her. Thank you, Lori.
Good morning. I am so happy to be here with all of you today. Looking at this crowd, seeing so many people that have put their time, their energy, and their resources to make this a reality is absolutely amazing. This is a truly transformational moment. The opening of the DuPage County Crisis Recovery Center marks a milestone not only for our county, but for the entire state. This moment is deeply personal to me. I began my career as a crisis worker, meeting people in their most vulnerable moments, helping them find safety, hope, and a path forward. Oftentimes, those interventions were done in an emergency room or in a local police station because there was nowhere else to go. Those experiences never left me. They shaped my belief that we can and must do better for people in crisis. For the past decade, I've dedicated my work to transforming the way our community responds to crisis. And today, standing here with all of you, I see that transformation becoming a reality. For too long, people in need of crisis care have faced a fragmented system. Access depended on the time of day, your age, your insurance, or what type of crisis you were having. That's not care, that's chaos, and people in crisis deserve better. We needed a place where anyone, at any time, from any background, could walk through the door and find safety, stability, and support. And now that place exists. The Crisis Recovery Center will meet people exactly where they are, whether it's a youth struggling with depression, an adult facing a mental health emergency, or someone overwhelmed by substance use. Our team will be ready to provide immediate assessment, stabilization, and connection to ongoing services with compassion, with professionalism, and with urgency. Because in crisis, every minute matters. This is the first of its kind facility to bring a youth and adult services together, to bring mental health and substance use together, all under one roof. We are proud to be eliminating barriers and simplifying access to life-saving and life-changing care. But we did not do this alone. The work it took to get to this moment reflects the power of collaboration. It took strong community partnerships with local police and fire departments, school districts, hospitals, and many community organizations. These are often the first people to encounter someone in crisis, and we are so grateful for their continued trust and support. This milestone was also achieved because of DCHD's leadership and staff, who turned a bold idea into a reality with vision, determination, and so much heart. And it became possible because of the people of DuPage County whose support and openness to innovation made it possible to reimagine what crisis care can be. This is what happens when an entire community comes together, all committed to building a better way to care for people in crisis. Today's a day to celebrate, and it's also a day to look ahead, to carry this work forward with determination and purpose. Because the opening of the center isn't the finish line, it's the start of something new, a new standard for crisis care and renewed promise that no one in DuPage County will ever have to face a behavioral health crisis alone. Real help starts here. This is where the recovery begins. So thank you for being here, for supporting the vision, and for being part of something that will change lives for years to come. All right, so with that, I'd like to introduce the Executive Director of the DuPage County Health Department, Adam Forker, who has been a wonderful support and a leader in helping us get this building open.
Wow. Okay, thank you all so much for being here this morning. It's really an honor to share this moment with so many leaders and friends from every corner of DuPage County. Everybody played a role in making the Crisis Recovery Center come to life. As you've heard, today marks a new chapter for behavioral health care in our county. Moving forward, when someone in our community feels lost or overwhelmed, they will have a place to turn. A place that is compassionate, a place that never closes its doors, a place that offers hope. I'm deeply honored to be a part of this vision, a vision to help build the healthiest community possible. So to our elected officials, our local leaders, our community partners, thank you for your ongoing support. And to the extraordinary staff at the DuPage County Health Department, it's your belief in this mission made today possible. Your dedicated service to our shared community inspires me every day, and from the bottom of my heart, I thank you. And a special thank you to Lori Carnahan and Kathy Carey and the Behavioral Health Leadership Team. Their steady guidance, their vital contributions to this important work is incredibly meaningful. We want to support every person who walks through these doors and make sure they feel seen and heard, to know they are not alone, that we understand their challenges and that we will walk with them through their most difficult moments. The center will be for our neighbors, our friends, our loved ones, for anyone who needs it. And finally, I want to take a moment to recognize our two remarkable leaders on the stage here whose dedication made all of this vision we've talked about become reality. So please join me in acknowledging DuPage County Board Chair Deb Conroy and Health President Sam Thornatory. Thank you so much. We would not be here without you. Okay, so that's it. Thank you again for being here, sharing this moment with us. We will officially cut this ribbon. We're going to welcome everyone inside for the first time to the DuPage County Crisis Recovery Center. So, a little bit of housekeeping logistics. I'd first like to ask all Board of Health members, county board members, and state representatives to proceed to the front of the CRC. We're going to do the official ribbon cutting photos. And then immediately following that, tours will begin. So everybody should have gotten something that looks like this. A tour card. Everybody else, you're going to wait for your color to be announced. Then you're going to proceed for your tour. We have a lot of guests here today, which is wonderful. So this will be ongoing for the next hour, the 10, 15 minutes. You're in great company. Enjoy each other's company. Grab some water. I will see you inside. Thank you once more.
1, 2, 3. Our county-wide elected officials join the county board. Any other county-wide elected? Oh, yeah. And is that it? That's it. I think it's done. All right.
Yeah, I was like, I don't
All right, on 3. 1, 2, 3. Woo!
I'm here with Addison Mayor Tom Hunley. Tom, how are you feeling today about the Crisis Recovery Center building opening?
Well, this is great for DuPage County, and as it was said earlier in Deb Conroy, the County Board Chairman's remarks, normally it would be a situation where you take somebody in crisis to a hospital or other facility, but now they can come here, get checked out, and have care workers here that know exactly what they're doing, and it's a great entity to DuPage County.